Hi Sam, how are you today?
Good, how are you?
Good. So today we're going to be performing a couple neurological exams on you today. Any history of neurological disorders at all?
Nope.
Okay, good. We're going to go ahead and get started then. I'll have you just confirm your name and your date of birth.
Sam Morgan, 11/25/1997.
Okay, excellent. So first test we're going to do is what we call nuchal rigidity. I'll have you lay flat on the bed here, testing to see if there's any irritation in your meninges, okay? I'm going to go ahead and slowly lift your head up, and you're going to tuck your chin in towards your chest, okay? Any pain with that at all?
Nope, no pain.
Okay, excellent. So unlikely that your meninges are inflamed. Next test that we're going to do here today is called the Dix-Hallpike maneuver. I'm actually going to have you flip around to the other side of the table here. And then what I'm going to do is kind of gently move your head at a 45-degree angle and then place you backwards, and I'm just checking your eyes to see if there's any signs of vertigo, okay? All right, so just going to move back here and over. And you're going to move your legs up and off to the side. You're going to be off of the bed here. Okay. All right, so no signs of nystagmus. I'll help you slowly get back up here. Okay. And then next thing we're going to be doing is called the HINTS exam. Just checking for what we call vestibular neuritis. First thing I'm going to do is I'm going to have you keep your eyes gazed on my nose here, and I'm going to kind of move your head back and forth, just checking to see if there's any movement in your eyes, okay? I'm not seeing any movement with your eyes there. Next part of the exam is checking for your peripheral and your horizontal. So I'm going to have you just kind of look over to the side here. Okay, and then look off to this side here. Okay, follow it. Okay, just checking. Great. I'll have you look up and down. Yeah, there you go. Okay, perfect. I'm not seeing any nystagmus with that either. And then we're going to do what's called the cover test, just checking to see if there's any nystagmus there either, okay? So I'm going to cover one eye. Okay, very good. Unlikely that you have vestibular neuritis. Next test we're going to do is called a Jolt attenuation test. Do you have any headaches today? Okay,
Nope.
so normally this test would be done if you're experiencing a headache. But what I'm going to do here is just kind of jolt your head around. Okay, and if you were experiencing a headache, this would make it more pronounced or more painful, okay?
Okay.
All right, and then next test we're going to do is called Asterixis. I'll have you push your hands out like you're pushing back on something. Perfect. Okay, great. I'm not seeing any signs of flapping tremor, which would be a sign of metabolic encephalopathy, okay?
Okay.
All right. And then last test we're going to do is called the straight leg test. I'll have you lay back down on the bed here again. And then just checking for any nerve pain or what we would call sciatica, okay, with this one.
Okay.
So just going to move your legs straight up. Any pain with this at all?
Nope, no pain.
All right. And then same thing on the other side here. Any pain when I do this?
Nope.
Okay, very good.
Sweet.
All right, you can go ahead and get back up on the side of the bed then. All right, so very good. No signs of neurological issues today, okay?
Awesome, thank you.
Very good.